Okay, hi everybody. How's everybody doing?
Good, thanks.
Yeah, good. My name is Kate Snow. I'm with NBC News. I'm the moderator here, and if you don't know what I do, I'm a senior national correspondent for NBC. I contribute to all of our various platforms: Today's Show, Nightly News, Dateline, NBC News Now, MSNBC. I'm also the anchor of Nightly News on Sunday nights, so the 6:30. Actually, I think here it's at 5:30 in Colorado. And with me are two wonderful women, also journalists and writers. So we're going to talk, you should know why you're here, right? We're talking about the opioid crisis. We're talking about reckoning. Beth Macy, I'll start with on the far side there. Beth is a Virginia-based journalist. She's the author of a book you might have heard of called Dopesick, which was the basis for the television series. And she was also an executive producer and co-writer in the writer's room on the Dopesick Hulu series, which I encourage you to watch if you haven't. She's also got a new book coming out in August.
August 16th.
And why do I not have the name of it in front of me? Lazarus.
It's called Raising Lazarus, and the subtitle is Hope, Justice, and the Future of America's Overdose Crisis.
So it's another look at the opioid epidemic through a different lens, and a lot of, we'll talk about this, but looking at strategies and things that are working as well, so not just the problem, but some of the solutions. Yeah. And then right here next to me is Sari Horowitz. She is a journalist with the Washington Post. She covers the Justice Department for the Post, where she's been a reporter for 36 years. She's been awarded the Pulitzer Prize, not once, not twice, not three times, but 4 times. Yeah. She reports on crime, police, legal issues, education, social services for the Post Investigative Unit as well, and for local and national staffs. She previously worked at Congressional Quarterly. She too has a book coming out, which I love that I got 2 books that I read before coming here. Full disclosure, I did not have time to read the entire books that I just got them the other day, but they're really good. American Cartel is the name of her book, Inside the Battle to Bring Down the Opioid Industry, and that comes out in July, am I right?
July 12th.
So July book, August book.
Right.
I'm sure they'll tell you exactly where they can they pre-order on Amazon?
Yes,
Let's just do it right now.
Yes,
okay?
pre-order.
Because seriously, they're both incredibly talented writers, and from what I have already been able to read of their books, they're excellent and detailed and thorough. I'm going to start with Beth, because I want to talk about Dopesick a little bit, and I think a lot of people probably here, how many people have seen the series? Show of hands, yeah, most people in the room. You really took a deep look at the opioid crisis. You really focused on a small town in Virginia and told it that way. You've got this new book coming out, as we already talked about. From your perspective, are we at a point of reckoning right now in this country?
You mean a point of like getting justice?
Reckoning with justice, getting people held accountable for what happened, for all that you wrote about?
I think not yet. And I say that because the Purdue case, Purdue was OxyContin was the taproot of this overdose crisis. Purdue Pharma, almost single-handedly, well, with the help of some bought-off regulators and politicians, changed the narrative that for 100 years we had known that opioids were addictive and were only to be used in cases of cancer, end of life, post-surgery, but not for weeks and weeks. And they changed that notion to say OxyContin was virtually non-addictive. And that sort of just, the horse was out of the barn at that point. And some people will say, yeah, but people are dying from fentanyl now. First we had prescription pills, and then when they got hard to get around 2010, then it went to heroin, and then fentanyl around 13, 14, and now there's fentanyl in just about all illicit drugs, to the point where teenagers who are just experimenting, some of them are dying on Xanax that's actually pressed fentanyl. And so with this opioid money about to come down, I wanted to write the new book about what's out there that's working, because I don't want same old, same old. I don't want the money just going to drug warrant mentality and more policing. I want this money to come down to evidence-based practices. And you say, well, that's great. And there's tons of evidence, right? But there's so much politics in this, such that one of the communities that profile in the new book is Charleston, West Virginia. And they have the highest HIV rate in the nation. The CDC pronounced it the most concerning. And during this huge HIV spike, which is all injection related, the Republican supermajority in West Virginia just outlawed needs-based needle exchange. So you can only get needles if you turn in your dirty one, which who has that? And also, if you're a homeless person on the streets, you have to prove ID. Well, most of those folks don't have ID. So there's just a lot of not only stigma that we need to break down, but a lot of programmatic things we can do. And the good thing about like the narrative in Dopesick and Sari's narrative in American Cartel, which is such a gripping story, is that it points the finger back to the people who did this, not on the people who used drugs, but to how they were victimized too. And you know, there's now 1/3 of American families have someone in their family. And almost, I would dare say, there's probably not a person in this room who hasn't had some experience.
Yeah.
And so that's why I think the reckoning is so important.
So your first answer, though, was not yet.
Yeah.
So Sari, I'll go to you, because you write extensively. You're not actually focused on Purdue in the way that you were, Beth, focused on Purdue and the Sackler family. You write about all kinds of players, right? You write about the distributors, you write about the pharmacies, all of whom have been part of lawsuits, which I feel like we might need to take a step back for the audience and just like remind us, educate us about what the heck is going on, because it's gotten really, really complicated. There are a lot of players, and there are a lot of efforts toward reckoning, a lot of efforts toward accountability in the court system that stand in all different stages right now.
You're right, it is complicated. So most people, when I ask them, who do you think's responsible? Or what do you think of when you think of the opioid epidemic? They say Purdue and the Sacklers. That's sort of the narrative. And by the way, if you haven't read Dopesick and you haven't seen the Hulu version of Dopesick, you must, because it is so powerful and so groundbreaking and important.
Thank you.
And but what I write about in American Cartel is, while Purdue ignited the epidemic, it wouldn't have been really possible, as we know it, without a constellation of other companies. Manufacturers, distributors, and pharmacies. And some of them are the biggest companies in America. Some of them are household names, Walgreens, Walmart. Some of them I hadn't heard of, and many of you may not have heard of, like Mallinckrodt, based in St. Louis. And Mallinckrodt, for example, in 2006, the epidemic's really going in 2006, Purdue, I think, manufactured 307 million pills, pain pills. Mallinckrodt, it was like 9.6 billion.
Wow.
Wow.
So, you know, we needed...
And they're out of business now, right?
They are now bankrupt, yes. So it wasn't just the manufacturers, as you said, the distributors. So they're the middle people. There's the people who make the pain pills, and then they're the people who ship them, and then they're the pharmacies. And the ones who ship them are like McKesson, Cardinal Health, AmerisourceBergen. And under the law, there's the law from 1970, the Controlled Substance Act, the distributors are supposed to, when they see a pharmacy that has ordered an enormous amount of pain pills, many more than they've ordered in the past, thousands more, they're supposed to stop the order, kind of find out what's going on with the pharmacy, and tell the DEA, the Drug Enforcement Administration. And they didn't do that. And so hundreds of millions of pills are shipped into places like Appalachia, Florida, all over the country. And so now what we're seeing are the manufacturers, the distributors, and the pharmacies being held to account through lawsuits.
Some of them, right? Because the last, I don't want to, no spoilers here, but the very last part of your book, you do kind of go through all the cases that are pending right now.
Right.
And I, as a reporter who covers this stuff, I was like, wow, I hadn't really kept track of the tally. And it looks like it's about 50-50 as far as like judges siding, with the plaintiffs and holding companies accountable versus saying, you don't have any legal standing here.
Exactly. It's very complicated. If you're reading the paper, you read about this trial and that trial, and it's like, what does it all mean? So very briefly, I'm going to tell you a story about someone in the book who started the lawsuits. In West Virginia, there's a small town attorney, Paul Farrell, who had lived in Cabell County for generations. His family had lived there, and he saw the devastation. And he said, we need to start suing these companies. And so he filed a lawsuit. He filed in the Ohio River Valley and West Virginia, and other attorneys started to do the same thing. And so then Farrell went to a special judicial court and said, let's have multi-district litigation, which means you bring all the cases together under one roof. And that was done in Cleveland. So it's all the federal cases. Giant cases. And it's 24 drug companies are being sued by 4,000 municipalities. So small towns, counties, little villages even, and Indian reservations are all suing. And so what we're seeing are trials here and there. Some they're winning, some they're losing. But I think what's really important, there's been some settlements. And the biggest settlement was in February. It was for $26 billion. And that is a settlement made between the 4,000 plaintiffs that I talked about, the towns, the cities, the Indian reservations, and the big three distributors, AmerisourceBergen, Cardinal Health, McKesson, and the manufacturer Johnson & Johnson. And that money now is going to start to be doled out to these communities.
Which is the money you were talking about, right, Beth?
Yeah.
When you said it's a real question, like, where's the money going to go? Mm-hmm. So that's my question to you. Are you hopeful that this money will get earmarked for the right, if you will, the right things, the things that are really necessary? Because I think back to tobacco and big tobacco, and that money didn't all go toward helping people who had lung cancer or who had suffered from smoking, disorders because of smoking.
Yeah, and if I may just circle back to Purdue, because I've been following kind of where they are, and they were headed for settlement. They were up to a $3 billion settlement in 2019, I think. Yeah. And rather than go to the MDL that Sari's writing about, they filed for bankruptcy. And they don't file for bankruptcy in Stamford, Connecticut, where their business is. They file in the one jurisdiction in White Plains, New York, where there's one judge, a sole judge named Robert Drain, who is known to favor third-party releases. And that means the Sacklers their company can file for bankruptcy when the Sacklers themselves are not bankrupt and are, in fact, nowhere near bankrupt. And so the settlement now is up to like $6 billion. It's in appeals. We still don't know what's going to happen. There's still a couple objecting parties that have said, including the Department of the trustee's office, which had said what Judge Drain did was unconstitutional. So I follow this group of activists led by the artist Nan Golden, who have been trying terribly hard, this is for my new book, to get the activist voice heard in court, which when it went to Zoom because of COVID, they couldn't even protest outside the courthouse. But they did that. And it's a pretty interesting, dogged story. But back to your question, the hope is, one of the early lawyers was Mike Moore, who was actually sort of the architect of the tobacco settlement, which remains the largest settlement in American history. But I think, 2% of the money, or maybe 3%, got down to the level that it was supposed to. It got usurped for potholes and
for other stuff, right? That the government needed money for.
Yeah. And so, Mike also has been crusading about this because the money needs to be put for prevention and for treatment. We have an 88% treatment gap in our country. That means that in the past year, only 12% of people with opioid use disorder, or OUD, have managed to get treatment in the past year. I mean, that's unconscionable. And what I think needs to happen is that rather than some money here appropriated for 6 months or some money here for a year, we need to have the equivalent of the Ryan White Act, which is money that Congress declared so that people, back in the era of HIV and AIDS, that people could get treatment on demand. Because what's happened out in our communities, and you know this if you have a relative, is that people are so stigmatized, they're treated so poorly at hospitals, at the doctor's office, at the front desk of the federally qualified health center, unless they happen to meet the right person, that they don't even want to go back. The largest group of people with OUD right now, and it's 40%, say they don't want to stop using. So what's that mean? That means we have to go to them where they are in use and be okay if they are still using, we're going to get them clean needles so they don't spread disease, hepatitis C and HIV, and we're going to make little threads of trust. We're going to build up that trust so that when they're ready to stop, and I've seen it work over and over again, they finally will. But that is a system that we are nowhere close to building yet in this country.
And one more thing about tobacco. Unlike the tobacco settlement, in this settlement, there are rules of how this money can be used. And the only way that we got to this settlement is that each locality figured out a formula so that the state had to give them that money.
You're talking about the Purdue settlement?
No, not the Purdue,
No.
the $26 billion.
Okay, the Johnson & Johnson, $26 billion, yeah.
Exactly. And by the way, in all these settlements, you should know that none of the companies have taken responsibility. In fact, they denied responsibility. No executive was ever prosecuted. No executive ever went to jail.
No
and that
apology.
is something, no apologies. And that's something we both hear when we go to these communities. Yes, people are happy that there are lawsuits and settlements, but they feel like nobody was punished really for this. On the other hand, going forward, there is an independent clearinghouse that's going to watch how this money is being used, and hopefully, unlike tobacco, it will get to the localities.
And just to play devil's advocate, I wrote down a quote from Purdue's lead bankruptcy lawyer who said in court, quote, "We are bringing in billions and billions of dollars to save lives." So they're framing it as, we're doing we're doing a solid here. We're bringing in billions of dollars that's going to help people and save lives. I guess I still keep going back to, is that actually going to happen? Because as you just explained, it's still stuck. I've reported on this like 5 times now, I think. There's a breakthrough, there's a breakthrough, there's a breakthrough, there's a settlement, and then now it's held up because, I don't know if we're losing you guys in the details, but there have been so many appeals now
Even
that it
if
hasn't
the
happened.
$6 billion goes through, which it
This is the Purdue. we're talking
may, they still are going to have held on to, $7 billion? I think they made $13 billion total. Now, they'll tell you a lot of that is held up. We know a lot of it's in offshore accounts, right? So the government can't get it. But they have not apologized.
Do you think a Sackler will ever end up criminally charged?
Well, I'd love to hear Sari's take on that. The activists that I follow in the book held a protest in front of the DOJ on December 3rd. And they had Deputy Attorney General Lisa Monaco on a 2-story curtain and saying, we want you to prosecute. Because all this bankruptcy is for civil suits, but the criminal is still up in, it's still up for grabs. So, and they're saying they have to resolve the civil before a criminal suit can be filed. So I think there is a chance. I think, as somebody in the book says, the public outrage can change things. And I think there's been a lot of attention through journalism and even through our Hulu show. I mean, a lot of people know the story that didn't know the story before.
Yeah.
And I'm hopeful that it moves the needle.
Yeah, Dopesick definitely raised the consciousness, I think, about it. What would your answer be to, could there potentially be criminal charges against, maybe not just the Sacklers, other family, other owners of other companies?
I mean, one thing in my book that we talk about is that for years, the DEA agents built cases for criminal prosecution, built cases against various companies, and we named them all in the book, for criminal prosecution. And instead of moving forward with this, the Justice Department pretty much quashed it and decided on fines instead. And the fines, while they were millions of dollars against these companies, they were really like a slap on the wrist to the companies.
Okay, but what are you really saying here? Because I know what you argue in the book is that they're getting protection. These companies have friends in high places.
Yeah.
Well, we've talked about this. There's a whole revolving door in Washington. And I don't know if many of you know much about this, but in many cases in government agencies, people who work for the government agencies and regulate companies then go for much more money to work for the companies. And this really happened with the Drug Enforcement Administration, where key players who were working on policing the opioid companies left and for a very high salary went to work for the drug industry. And then, in unbelievable stories we have in our book, they worked to get Congress, they helped the drug industry get Congress to pass legislation that undercut the DEA in their work to stop the companies and what they were doing in the opioid.
Made it
epidemic.
harder for the legislation made it harder
Exactly.
for the DEA.
And they gave it this BS name, right? Do you remember
Oh,
the name
ensuring-
of it? It sounded like it was a
patient
great
safety.
name. Yeah.
And it
Yeah.
was a name that meant nothing. And what it really was, and most members of Congress had no idea what it really was, and they all signed on to it. They changed, because a former DEA agent advised the drug industry what to do, they changed language, just a couple of words, that made it nearly impossible for the DEA to go after these companies and shut down their warehouses when they were shipping hundreds of millions of opioids illegally.
And so the fines are just like the cost of doing business. And as somebody in our show and in Dopesick says, like, if white collar criminals don't go to jail, then the behavior continues. It's not going to change until they start going to jail.
Sari, you focus on a guy named Joe, right?
Joe.
For the first half of her book is about, just tell us a little bit about him and what,
Okay.
you've generalized it, but tell specifically, what was he trying to do? He was
Thank
at
you
the
for
DEA.
asking me that. Yes.
Yeah.
So Joe Renazizi is a main character in our book. He is a DEA agent. He was a DEA agent for 30 years. He was a lawyer. He had a degree in pharmacy. And he was in charge of the unit in the DEA that polices these companies. And he was on the ground seeing this all unfold in places like Virginia and West Virginia. And he talked to all the families. He just saw people dying everywhere. And so he started to go after the online pharmacies and the corrupt doctors, and he realized very quickly, this goes higher. This goes higher. So he started to go after the distributors, who I explained to you were breaking the law by shipping when they knew there were questions at the pharmacies and with the doctors. And so he started to go after them, and he and his team began shutting down their warehouses. You know, many of these companies, Cardinal Health, McKesson, AmerisourceBergen, shutting down the warehouses. And then they got fined by the DEA. And he said to them, guys, you have to stop this. You're killing people all over the country. And so they paid the fines, and they said, we're going to be better. And then they went back, and they did it again. And they fined them again. So the companies decided, we're going to go after Joe and the DEA. And they took the DEA, they went to court. And they lost in court. And so they decided, okay, we need to change the law. And so they, with a lot of money to congressmen and a lot of connections in Washington, and again, that revolving door I was talking about.
And this is the same law you were just
They
talking
changed the
about.
law. They changed the law, and then they went after Joe, and that's a whole part of our book, and basically crushed him and his team and forced him out of government.
Yeah, it's a sad ending. The day that he goes to get his badge, which is
Right.
usually a big ceremony when you're retiring at the DEA, you get, right? You get
Exactly.
like the head guy or the administrator
you with your
presents
badge.
you with your badge. He doesn't even get that because he doesn't want it. He just wants to leave and get
And he
out.
was a revered agent. I mean, he
Yeah.
won all these awards. He's one of the most senior agents, Joe Renazizi, and he's forced out of government basically by the drug industry. And that's when the lawyer in West Virginia and all the other lawyers pick up the fight.
Yeah, we're sort of going out of order, but you're following us, right? We're jumping around. Beth, you write a lot in this next book about solutions, as I said before. And I wanted, can we talk a little bit about some of the positive things that are happening? Because there are people, I'm sure people in this room in the medical field know individuals and communities and groups and communities, organizations that are doing amazing work. Especially with, as you mentioned, fentanyl right now. I report on that all the time. It's really insane what's happening. I mean, I've talked to probably a dozen families in the last 6 months who've lost young people because they accidentally took fentanyl. They didn't mean to. They took what they thought was a pill, or they thought it was cocaine or something, and it was full of fentanyl. Because the Mexican drug cartels are intentionally putting small amounts of fentanyl in because they know it makes you feel good, and they don't care if they don't put the right amount, and it kills you.
And they sometimes put it in little pills that with an M on them, so they look like they're Mallinckrodt prescription pills. This is how fentanyl ties back to the prescription pill. And so people think they're taking oxycodone, and it's really fentanyl.
And it's
They
fake.
call them dirty 30s.
So, but my question was like, what do we do? Because people are dying. What's working?
Okay, I'm going to tell you two stories. One is my new book begins in the parking lot of a McDonald's next to a dumpster, where this nurse practitioner who is volunteering for a harm reduction group is meeting a person who has been chaotically using heroin for 15 years, and he's never had access to MAT or buprenorphine, which is one of the addiction drugs that evidence backs to help with OUD. And he meets him there. The guy's high. He's crying. He's like, I'm going to die if I don't stop the needle. And so Tim's going to give him a discount prescription for buprenorphine that he's arranged through the federally qualified health center where he works. And he tells him two things. One, you can get better. So most people think they can't. Most Americans think these folks can't. We've like given up hope. We have to have hope again. And so you can get better, and two, don't disappear. And what he means by that is, we have an appointment next week at the same dumpster. If you can't come to me, I'll come to you, text me. If you relapse, even though you're taking buprenorphine or you do meth, still come. And the idea is that we know it doesn't work the first time, second time, third time, but if you stick with people and you meet them where they are, then it can work. And so I've been blessed in the last year. I've seen people turn from running trap houses now to being leaders in their communities, giving out fentanyl test strips, needles. And the other story, so that's harm reduction in a nutshell, like non-judgmental, we're gonna help you, right? Whether it's a sandwich or housing or getting on Medicaid. The other story I want to tell is this really great law enforcement story. There's a sheriff, a female sheriff. I just want to say that a lot of these programs are run by women, just saying. There's a female sheriff in Fairfax County, which is just outside of DC, named Stacy Kincaid. And she decided, because she was seeing people just recidivism in and out of jail, then they'd be on probation, they'd flunk a drug screen, and then they would come back, right? That's the cycle, because they haven't gotten any help. So she brings in trained medical staff to do MAT in the jail. And the jailers don't like it. They're like, what? We don't do this. We're arresting people for selling diverted bupe. And she says, no, we're gonna do it. And the ones that didn't get on board, we had to let some go, she said. And then she brought in this harm reduction group with their peers, these are people in recovery, to meet with folks who were in treatment while in jail and start to work on their exit plan. And a lot of rules had to been broken there because all the peers are felons and they're not allowed to go in jail. So things had to change. Like, we can change things if we want to. She did it. Yeah. And so then when folks get out, their peer, who they already know because they've been meeting weekly in the jail, picks them up and takes them to either a sober living or someplace by agreement that they've arranged to go to. And their counselors, through their community service board, which is like the state-funded mental health services and addiction, their office isn't in somewhere else. Their office is in the jail. So, things that are working are bridging this idea of moral failing has to be imprisonment or jail versus treatment, and because everybody's falling through the gap in between. And when you have these people actually working together, I think that's where the special sauce.
I'm sitting here thinking of a story I did in Buffalo about a mobile unit that goes to the county jail and sits right outside, and they had to break the rules to figure out how to get the inmates or the people inside to come out and get the treatment. Yeah. But there are things. I'm sure you've reported too on small efforts that are working that are scalable, and the peer support too. I did a story in Ohio about that. That seems to really make a difference. I want to save some time for questions from you guys, but last word.
These are all great things. I think the challenge we have now is it's not like this is historical. Like we talked about Dopesick and the stories in my book, but this is happening right now. We are in the midst of the worst drug epidemic in American history. Yeah. More than 600,000 people have died from opioids. Last year, 100,000 people more than ever in history. And fentanyl is pouring over the southwest border. Mm-hmm. My colleague was just there, and he said the authorities caught one truck, but six more get through, and Mexican drug dealers feel like this is the price of doing business. You lose one truck. So that's the challenge, is fentanyl. Yeah,
I interviewed the DEA administrator last fall, and she concedes how difficult it is right now. That they just can't stop everything the mass quantities of this stuff that's coming in. Why don't we go for some questions? Do we have microphones somewhere? Yeah, cool. So I'll go to you first. Let me just get a mic to you. Right up front.
Or 18.
And who wants to be next? If anybody else has a question, raise your hand. Okay, we'll go over there next.
Two related questions. You've talked about the drugs that were obtained via prescriptions from a doctor's office. What percent of the drugs that are abused come that way versus drugs that are purchased on the street? And then the related question is, why are the drug rehab programs so expensive or so terrible that they don't really see much results with an extremely high recidivism rate?
Well, more than half of all rehabs don't allow medication-assisted treatment when we know that methadone and buprenorphine are the gold standards of care. You see families like remortgaging their houses to send people away to this out-of-state rehab. I mean, the young woman at the end of Dopesick, they send her all the way from Virginia to Las Vegas. She bombs out of there because she's not getting the evidence-based help. And then she's homeless and middlemaning for drugs on the streets of Las Vegas. She ends up murdered on Christmas Eve. And they have I mean, it's like a money factory. A lot of those places are. They make so much money on testing and patient brokering. But your first question was? What percent of the drug abuse
is prescribed now?
Prescribed.
I think it's changed a lot.
It's changed.
In the beginning, it was a lot. But think about this. So it was like an iatrogenic addiction wave that began with OxyContin in 1996. But because there was so many pills out in America's medicine cabinets, that meant that your grandkid or your kid could take those leftover pills. And that's how it started. And then once people got hooked, there was a lot of doctor shopping where, especially in Appalachia, where the jobs were going away at the same time, a lot of folks would get pills. They'd either go to the doctor themselves or they'd steal them. And they would take half and sell the other half. And that was a way they paid their other bills. So a lot of this wasn't directly prescribed, but had those pills not been flooded, really strong pills, like 80 milligram, at one point they had 160 milligram. Right. I mean, that would put an elephant down. And had that not happened, we wouldn't be where we are. And I just ran the numbers from 1996. We've actually lost 1 million people. And the projections are it's going to be at 2 million by 2029.
But you said the kids get most of the stuff on the street? Or they
Well, now we're talking about different things, right? So historically is what Beth was just talking about and how it all started. Do you want to take this? but
No,
present day, I'm doing a lot of reporting on how young people are getting present day all manner of opioids. And it's a mix, right? There are some people that are buying them through social media. You can easily find a dealer and get pills through social media companies, connections that you make. I'm not going to name names because then I'll have to tell you what all the companies say, which is that they're working on it. But separately, there's also still an illicit market, right? So there's still, buying from dealers in person is happening too. And there's still a supply, I think, left over from actual pharmaceuticals that are still on people's shelves that people try to take. So it's a mix. Would you agree?
I would agree. And, there was this time in Florida when people would go to Florida to the...
Right, pill mills.
While many doctors did the right thing, many doctors did not. And were not even giving people examinations. And they were going to these pill mills and they would get the pills there, come back and sell them.
But a lot of those have been shut down.
Yes,
at this
many of them have been shut down.
Yeah.
Most of them.
Most of
yes.
them, I would say. Yeah. Oh, wait, I'm sorry, you were next. Yes, go ahead.
Yeah, I want to compliment you on your work, and primarily the lawsuits and all that are against inappropriate marketing of these companies, inappropriate pushing of these drugs. My name is Bob Wales, and I'm a physician from California. And I want to speak just for a moment and ask you a question. I want to represent the appropriate use of opioids in patients in need, which is my practice. And I want to make sure that they have a voice in all of this as well. And I know you recognize that. It's not a voice that's often heard, but there's a certain percentage of patients who have really severe pain needs where opioids are therapeutic and increase function. When they're followed regularly by physicians who monitor them, who do urine testing, who check the physician monitoring drug programs, and every state basically has a program that's a database that allows you to see where they're getting drugs from other sources medically. You can make sure they're not doctor shopping anymore. So anyway, I just want to speak for them. and agree with you and ask you a question at the same time. The real problem is access to care for those people who do have addiction and opiate use disorder. And it's a crisis in our country, exacerbated by COVID, of course. But there's a huge shortage of experts who are willing to deal with this. And it's part of our mental health crisis. I want to make sure we all understand the agreement is that this is a medical problem. And I like the idea you say it should be decriminalized. It should be treated as a medical problem. And we have lots of other addictions as well. It's a medical problem. How can we get more resources and better access to care for all of those patients in need?
Yeah, I appreciate the thing about pain patients. I hear from them a lot.
Yeah, me too.
Yeah,
I did one.
Me too.
I did one story on Nightly News a couple of years ago, and it's still circulating. I still get people saying like, "Thank you for recognizing that some people."
Legitimate pain patients.
The woman I profiled in Washington State was in enormous pain every single day and was on opioids successfully. So,
Yeah,
yes.
and she gets like forced tapered. I mean, that's terrible. She's going to be in the same condition. A lot of those patients are forced to go to the black market or are committing suicide in some cases. But the idea of just like working on that treatment gap, which is only 88% don't get care. I mean, I think the first thing, I obviously think Medicare for all would be great. I also think Xing the X waiver. So every doctor that's going to prescribe buprenorphine has to go through an 8-hour training session and get a DEA waiver to prescribe buprenorphine. Now, Biden has made it, and they could only go like 100 patients, and then 250 is the cap. Biden has made it so all doctors can do up to 30. But a lot of it, I'm going to call doctors out a little bit here, they don't want to do it. They'll say, we don't want those people in our waiting room. Guess what? Dude, they're already in your waiting room. There's a great quote that I heard from an addiction doctor that I met at an ASAM conference a couple years ago, and it's from 1926. It's Dr. Francis Peabody at Harvard said, "For the secret to patient care is to care for the patient." And so we only have 6 to 8% of doctors willing to do that waiver. Now, how many doctors are taking advantage of that? Oh, we can treat at least 30 without the waiver. I don't think many people are doing that. So it's a real, it's a stigma at all levels of our various systems. And I think like a Ryan White Act for addiction would be amazing. I think Medicare for all would help a ton. I think this movement it's called X the X waiver, meaning that, it's ridiculous when you think about any doctor can prescribe opioids without a special training course. The average doctor only has, I think, 4 to 8 hours of training on addiction during medical school. And we are still, taxpayers are funding graduate medical schools. Doctors are coming out of school without being able to identify OUD and SUD, substance use disorders, and or treat it. We shouldn't be paying our taxpayer money into those programs. All doctors, and I always say when sometimes I get more worked up than other times, but I'll say, I know y'all didn't go to free trips to Florida on Purdue's dime, but you all participated in a system that allowed this to happen. And I'm not blaming you in particular, but you need to be part of the solution now.
Do we have more questions? Yeah. I saw this hand first up front.
Hi, I'm Andrew Penn. I'm a nurse practitioner in California. I want to also just add to the buprenorphine issue that for nurse practitioners, many of whom work with marginalized populations who have substance use disorders, we have to do 24 hours of buprenorphine training, which is ridiculous because 8 is too many and 24 is ridiculous. I've done the training. I have an X waiver. There was nothing in the extra 16 hours that wasn't in the first 8 hours. And countries like France don't have additional barriers, and so they have much more use of medication-assisted therapy, which has, as you've already pointed out, has strong evidence and is life-saving. So it shouldn't be easier to prescribe the disease than it is the cure, which is the situation we have now.
Let me get to another question because we're getting a little tight on time. Let's see, who over there? And you have your hand up too. Okay.
Yeah, I just want to say thank you guys so much for bringing up harm reduction and peer services. I think those specifically are integral in finding the solution to this problem. I know a lot of harm reduction services, such as safe places to use drugs and overdose prevention centers, are illegal in a lot of places. Through your guys' work, have you seen that shifting since this has been in the media more and in the courts more?
Okay. Yeah, well, so we've had 2 overdose prevention sites open in New York City, and they had like 30 saves in the first week, I think. You will hear over and over from people who have studied them, there have been 0 deaths. And I know it sounds counterintuitive. We're gonna have supervised consumption. We're gonna assist in people using drugs. Well, we're gonna medically monitor them. And by the way, it's not unlike what needle exchanges do, where they make a relationship with them. We know that people who go to needle exchanges are 5 times more likely to get treatment eventually. So it's all about building up those threads of trust.
So she was asking, do you know if the legal landscape has changed in the States? I'm not sure. I know on fentanyl strips, because I just did a story about fentanyl strips, which are test strips that you can take your drug that you're about to take, that you're intending to take. Like, let's say you have cocaine, and you can dissolve some in water and put a little test strip that almost is like a pregnancy test that shows you, or a COVID test, it shows you the lines if there's fentanyl present. So then you know you've got a bad batch and it could kill you, and you don't take it, is the idea. And I know that some states have been moving.
You just take a little bit.
Right. And I know that some states have been moving toward not treating those strips as drug paraphernalia, which currently they're outlawed in some states as drug paraphernalia. And now there's a movement to change those laws, and a lot of college kids have been behind
College kids are really
some of
using
that.
those.
Yeah, and it's spreading across the country now, thankfully. But I'm not sure about the broader picture, Sari. Do you?
Yeah.
No, but I know that it's very popular with college kids to get those strips because of parties where there's drugs and they don't know what's in the drugs.
Okay, we had one question up here and one in the back.
Hi, I have a PhD in dyslexia and ADHD, and I have a learning center for many years. And one population that is really susceptible is the ADHD adolescents and high school and college kids, because many parents choose not to do the routine medication for ADHD. So a lot of these kids self-medicate and get involved with street drugs and other things. What I want to know is, I've seen some go through rehab and come back, but how do you know if they're functioning if they've relapsed?
This is such a tough issue. Everywhere I've traveled, and I bet you agree with me on this, we talk to people who have kids who have gone through rehab, and then they relapse. And then they go through again, relapse, go through again. And so it's so important to have the funding in these communities, and hopefully that will come out of the settlement, so that people can go through rehab more than once and for longer periods of time, because addiction to opioids is so powerful and so hard to kick. And it's not a quick rehab situation. Wouldn't you agree with that?
Exactly.
I mean, yeah.
Yeah, I mean, that is the largest population of people that don't want to stop using. But the rehabs have been proven over and over to be ineffective, that the staying at home in the community, which is what you're going to come back to eventually, is much more effective with the MAT. Only 1 in 5, I think, according to ASAM, even needs rehab. I just met a gentleman yesterday named James. Are you here? Yeah, James told this great story of...
Oh, he's the next one that had his hand up to take the mic.
James, tell your story about the 4 communities in northeastern New Mexico, because this is a great story about what can be done well with the opioid money.
Okay. Well, thank you. First, I was going to say thank you for your courageous journalism, and I do want you to tell the story of what you thought might be happening in the background, because you take risk when you do this courageous journalism, and I think some of the powers that be didn't like you coming out. So I'd love you to close with some of the real risks you took, because it's courageous, and we need to hear that story. So I'm an ethicist, and I work in this space, and I'll say that we are seeing guideposts and hopes that things can get better. The opioid settlement dollars are starting to trickle down in certain communities, a lot in the Midwest and there's opportunities to build facilities to support these communities and put things in place like that sheriff with the MAT program. So we're working in Clovis, New Mexico, where 7 small counties in eastern New Mexico with one of the highest suicide rates in the country, they've bandied together, put funds together, agreed that this one facility would be in one county. And while that might not sound so amazing, it is, because counties like to keep funds in their own communities. So they're putting that together. They're going to build a regional facility to support the eastern side of New Mexico, and there's great hope that they can do a regional facility in other pockets. There's not enough facilities. You can't build facilities in every community. There's not an economies of scale there, but by banding together, rural communities are showing that this can be done and that there's a path ahead. So that's the optimistic side of it.
Hey, James, I used to cover Clovis, New Mexico for KOAT.
Yeah, it's sad. The story there is that they came together because somebody walked into a library and shot it up and shot a 10-year-old in Clovis Regional Library. You might have known that.
Yeah.
And then they killed 2 women, both who had 2 kids. And they met there, I think, 6 months ago in that same place where there were blood-soaked carpets. And they decided they were going to do something about it.
Wow.
And they had police chief, fire department, and others coming together to fix it.
Well, good
So it
for
can
you.
happen.
And I want to ask his other question of you guys, but go ahead. You want?
Well, I just want to say something. Do I have time to say
Yeah,
something about
we have
his
2 minutes.
comment about the powers to be issue? And I want to talk about something that has really helped both of us in our journalism. I'm going to talk about Arcos for 1 second.
Please.
Is that so much in this story is about information that's been hidden, that the drug companies wanted hidden and the government wanted hidden. And it turned out there was this confidential DEA database, a secret database, that showed where every pill went in America, from the manufacturer to the distributor to the pharmacy. And when the litigation started, the judge in that case said that both parties had access to the database, but no one else. And so we wanted it, because that will tell us which communities are being hard hit, where are the pills going, where are they coming from. And we ended up filing a legal motion to get this database, and we lost. And then we appealed to the Sixth Circuit. And in the summer of 2019, we got this database. And it was so huge, the Washington Post and the Charleston Gazette-Mail was involved in this also. The Washington Post had to buy a new computer to crunch these numbers and figure out where all the pills were going. And when we wanted to file this legal motion, we went to Washington law firms to get someone to represent us. No firm could represent us because every Washington firm was representing the drug industry.
They had a conflict of interest.
And we had to go to a lone lawyer, who's really a hero in the story, in Akron, Ohio, to take on, it was a real David and Goliath story,
You
to
write
take
about
on
it
the
in the
drug
book.
industry, right, to get this database. And we now have it, it's online, you can get it without going into our paywall. I mean, it's open to everybody. You put in where you live, and you can see which manufacturer and which distributor and which pharmacy put opioids into your community.
It's historical, right? Like it's not.
Yeah.
It's from 2006 to 2014 because the Justice Department didn't want to give us any more data because they said it might hurt cases they're working.
But you can go into those communities and you could put your zip code in and it'll pop it up,
Yeah.
how many pills per person were sold. And then if you wanted to put more data on it, you would find that in those communities that had the highest sales of pills, they have the highest overdose deaths, they have the highest
Exactly.
food stamp, highest children born with NAS,
And foster
highest
care.
disability. I mean, it is really shocking when you overlay
You put the
two
overlap.
stories. Yeah.
Right.
So his other question, really quickly. I mean, I've spent hours on the phone with lawyers for the people that we're talking about on TV. I'm sure you guys have spent hours talking to the representatives of the Sackler family and Purdue and Johnson & Johnson, et cetera. Did you ever feel, he asked, did you ever feel at risk? Did you ever feel scared to do that kind of, the work that you both have done?
I mean, the lawyers have certainly threatened the newspaper. They've called us. They've written threatening letters. But I'm very grateful that the Washington Post has backed us up on our work, and we move forward.
I work out of my grown kid's former bedroom in a 4-square house in Roanoke, Virginia. And I've been scared at times. I've gotten some of the same letters. They all say, personal and confidential, not for attribution. And then they pick apart little things I've said in my interviews and say, you said it this way, but on page 97 of Dopesick, you said it this way. It's like, I got a comma out of place, and you're going to give me a hard time about that. And so somebody has to stand up for these people. And
Yeah.
Right. I mean, we go to all of the drug companies, distributors, manufacturers, pharmacies, and try to talk to them, and we put their point of view in all the stories to make.
They always say, we have behaved ethically and lawfully.
Yeah. Thank you guys so much. We're out of time. Really, really appreciate Beth and Sari. Thank you.
Thank you.
Thank you guys.